everybody. My name is Patty Sheets, and I'm the Director of Quality and Clinical Outcomes. And for this Infinicast, we wanted to talk to some folks who are participating in one of our pilot projects. As you may be aware, in January, we started a pilot project where we asked some of our physical therapy personnel to systematically do gait speed trials with the patients that they felt were appropriate. And so we have about 30 facilities who volunteered to participate in this pilot study, and it runs from January through March. So given that we're about midway through that pilot project, we thought it'd be helpful to hear from some folks who are participating in this and to hear about their experiences. So we've got 3 of our physical therapist members of our Infinity community, and so I'm going to ask if they could at this time introduce themselves and tell us where you are.
Hi, I'm Hoku. I'm a physical therapist at Prestige Care and Rehab at Menlo Park.
I'm Jessica. I'm a physical therapist at Prestige Camas.
And I'm Jason, also here at Prestige Care and Camas.
So let's start with Hoku. Hoku, can you tell us about what your experiences with doing the gait speed trials have been with your patients so far?
Sure. Gait speed trials at Menlo Park have been a positive and engaging experience. It's set an environment of competition and increased patient involvement within their treatment sessions and interest in their outcomes. It's been fun to ask our patients to push a little bit harder and to watch their responses when they see their improvements over even just 1 or 2 treatment sessions. Gait speed trials have increased our attention to clinical intensity. And so now we've started using 1 rep max and gait speed trials to show our patients the importance of the rate of rehabilitation, and how fast you get better is really important.
Hey, that's really neat. And that's kind of neat how doing one type of intervention a little bit differently has really encouraged you to think about some of the other ways in which you're doing your interventions as well. And it's neat to hear that your patients, it seems, are kind of engaged in the process as well. Jessica, how about you? How have you felt doing these gait speed trials have fit into your treatment sessions?
They're actually fitting in really nicely and much easier than we originally anticipated. We kind of have 2 designated areas that we have the area lined out in the facility, so that most times when we just come to the gym, patients are already aware of what the drill is, kind of thing. They do their 5 gait speed trials. So for me, I personally tend to do it in the beginning. Other therapists do it at the end. And it's much easier with the things already lined out to be able to just quickly get it out of the way, and also allows us to kind of play with different assistive devices for the patient. So normally, I think most times we usually kind of stick with 1 assistive device, but this kind of allows us to have more freedom and trying to different, whether we try a 4-wheel walker or a cane or different areas of just gives us more freedom to allow our treatment sessions.
So Jessica, with the assistive devices, have you found that one device seems to work the best for doing gait speed trials, and that it's kind of the best balance between safety and speed? Or is it variable from patient to patient? Can you tell us a little bit more about that?
It's definitely variable between patient and patient. I feel like the most of our patients probably use the front wheel walker, but we do have several that have been able to progress to a 4-wheel walker. We just have to be sure that that patient, sometimes they try to really be competitive with themselves and they start kind of running, almost like a running pattern. I shouldn't say running, but it's very much unsafe gait pattern. So we kind of then have to bump them back down to maybe a front wheel walker, just kind of remind them you're walking fast, safely, not running or not trying to run. So for the most part, I would say between the front wheel walker and the 4-wheel walker are the 2 main ones, and it really just depends on the patient population. I wouldn't say that one is better than another at this time.
You know, speaking to what...
It sounds like you've had some situations where maybe you tried a device and it wasn't the perfect device for the patient, so then you just made that adjustment, just like you would in any kind of a treatment. Is that fair to say?
Yeah.
Absolutely.
Yeah. Okay, good. Jason, how about you? What would you say are some of the barriers that you've encountered in trying to do the gait speed trials?
Yeah, honestly, for me, I haven't come into anything specific to the gait speed trials. It's more just the barriers that we see just on an everyday basis. You know, people who are, just feeling tired, pain, stuff like that. But that's nothing particular to the gait speed trials itself.
Have you felt as though that, have you had patients who you feel have, their pain has increased when doing the gait speed trials?
No. No.
No.
It would be more just, just again, like on a regular, someone just having a lot of pain in their hip, their shoulder, their knee, or wherever, and just any sort of exercise, walking, would, keep that, I guess.
So on those days, have you held the treatment on that for patients on those days, or have you been able to still do the treatment and just balancing it again with their pain? How have you managed that?
Depends just on kind of on how bad that pain is. A lot of the times, we still try to push through it, manage it, kind of see how they're feeling. We might start with one or two trials. Maybe we need to take longer rest breaks, be tween trials. But certainly still trying to get 4 or 5 trials in.
Good. It sounded like, Koku, from your comments earlier, that your patients were really kind of responding really positively, and it sounded like they kind of were getting into a little bit of competition. But was that more, do you feel like they were kind of competing with themselves, or have they been competing with each other as well?
At Menlo, we tend to get a population that's younger, they're at a higher level of mobility upon admission, and so we see that competition certainly within themselves, but to each other also. They'll see each other doing the gait speed trials in the gym, and they're cheering each other on, and it's really pretty interesting how that's encouraged the rate of rehabilitation. One thing is that the gait speed trials are so directly related to their outcomes in their home environments. So there's no translation that's required. We can just say, we're gonna walk faster, and that's gonna help you when you go home, and it's clear to them. And so there's no conversation that needs to take place about convincing them to participate. At Menlo, it's applicable, and it's great to have that freedom.
That's great. Jessica, you and Jason have a little bit more, a different population of patients, and maybe a little bit more traditional population that we see in skilled nursing. How about your patients? How have they responded to your efforts with doing the gait speed trials?
Well, I think it's been the same. It's been very positive. One of the best things that I like about it, and Hoku kind of pointed this earlier, the ramping up the intensity. We have a lot of people that, in the hallways, they could walk 300-400 feet with their walker at kind of their regular pace. We come in the gym and do 3 of those trials of, 13.12 feet at a higher speed, and they need to sit down and rest. I mean, that's one of the best, things that I like about it, because it does really, really push them.
Yeah, and
that's great.
I think on top of that, with the more traditional population, I have come across some patients that are kind of like, well, I've walked this pace my entire life. I'm 97 years old. I'm not going to change, but we kind of encourage them, and I think they do. We see a lot of other patients in the gym doing it, and so they see that, and they're more encouraged. But we also tell them kind of, well, it's not only important to be able to walk longer distances, but you have to be able to have those moments where you can have a fast burst of speed, such as crossing the street or something like that safely. And we just kind of give them the research back behind not the 6-minute walk test, the gait speed trials and the 13.12 feet and what it's related to. So I think with that research behind too, with the patients that are a little more traditional or stubborn behind the concept, that it does help them. And they do, being able to write it down, we have the binder of having everything written down, gives them a good kind of hard data of them of being, well, look at, this is the first week you were doing this at 20 seconds and now you're down to 10 seconds like a week later. So I think that's very encouraging too, just reminding them of the results that, hey, look at, you made a lot of progress and you said you weren't going to, this is the same speed you walked all your life.
That's great. And and that does seem to be, that's kind of one of the key elements of this intervention, is asking patients to systematically and consistently move faster and giving them that objective information about how well they're doing. So it's nice to hear that you're hearing some responsiveness to that from your patients, and even some of the patients obviously jump right in And some of the patients, you maybe need to help them understand the value of it, but I really appreciate your efforts in trying to help educate your patients on what this treatment could potentially do for them. You know, as we look at this pilot data, we'll be looking at the outcome data for all of the facilities who are participating in the pilot study. And so we're about 6-7 weeks into this. So far, just what are your general impressions about the outcomes that you're getting with your patients? Do you feel as though it's making a difference? Do you think you're making any greater gains in gait speed with your patients, or can you tell yet?
I'll say that at Menlo we're seeing some good improvements in gait speed, and also we're seeing it translate to the 6-minute walk test. I feel like perhaps they're not going noticeably faster in their 6-minute walk test, but somehow they're just getting a little bit further every time, and we're finding that that has a correlation to our patients' overall confidence with gait tasks. So we're progressing people further from front-wheel walker to four-wheel walker to single-point cane because they're spending more time up on their feet, and the challenge of having to go faster is giving them a little bit more freedom, and they're feeling a little bit more confident, you know, for better or worse, but that's what we want, is to encourage them to be more independent. So we're seeing it at Menlo, we're seeing the improvements in gait speed trials in terms of like general functional mobility within our facility. We've got a lot more people that are just up and about, and they're walking on their own power out of the wheelchairs. It's really encouraging for the other patients to see that happen too. They cheer each other on in the hallways. It's really sweet.
Yeah. It would be interesting to see if it is directly correlated to a 6-minute walk test thing, because I noticed the same thing. I feel like, especially right after we practice it, and then if we go to the 6-minute walk test, I feel like the pace is slightly faster than normal. So, I mean, that's something that maybe in future, or whether that's anything that, see if it's directly correlated, would be really interesting, because they are getting a lot, not just with the gait speed trials, but if they are taking breaks in between, they have to do the sit to stand transfer, you get to work on the correct hand placement and that. So you get a lot of training tasks that can be worked in just with this one activity.
That's great. And we will be, when we look at our data, we'll be looking at gait speed certainly, we'll be looking at total SPVB score, and we will be looking at 6-minute walk tests to see if we see, from a data perspective, any differences from before we started doing the trials across all these facilities to after. So those are great suggestions and consistent with our data plan as well. I have one more question, and that really relates to whether or not you have felt restricted. This is really a novel thing for us as therapists to do, which is to kind of commit to doing this somewhat standardized treatment, although I really appreciate the way you guys have described how it's not like you have to follow a set of rules. There are some principles, and you're using your clinical judgment to figure out how to apply that treatment appropriately with each of your patients. So I really appreciate you speaking to that. But still, kind of saying that we're consistently going to do this 5 out of 7 days, that's a little bit more, I guess restrictive or constrained in some ways than we typically are, where we kind of have carte blanche to do what we want to with our patients. So I'm curious now, after several weeks of doing this, how does that feel to you? Do you feel like you're kind of like, I'm kind of being forced in this pathway, or it seems like it's an okay pathway to be on? What are your thoughts about that?
So I know for us here with our full-time staff, it's been fairly easy, to do these. It doesn't take very much time at all. I think the only thing that we've ran into a little bit of trouble is if we have on a call staff coming in. That's really been the only kind of issue where we might not be getting somebody on a more regular basis doing these trials.
Yeah, and I think the restriction, I feel like I've had no problem fitting it in. I think the only time that's maybe pinching is when it's like a shorter treatment session, maybe 30 minutes, and you also have the progress report to do. So it's like trying to do all the testing as well as the gait speed training, and then writing the progress report. You kind of feel like you're in a very structured, quick thing that we're not normally used to, having to be something so structured and kind of like that. But it's doable.
Okay. Good. And I think then too, once we can see our data, our data can kind of help us to determine whether or not it's worth it. I think that will be the the question for us. And so it sounds like it's a little bit, maybe constraining isn't the right word, but it's certainly a little different from your more traditional practice. But if the data show that it was beneficial to your patients, then that kind of makes you, I would think at least, maybe feel a little more confident saying, this is the right pathway to be on.
Absolutely.
Does that sound consistent with the way you have been thinking through it?
Absolutely. Yep.
That's great. That's great. Hey, you guys, thank you so much for having this conversation with me. Is there anything else that you want to touch base about that I didn't ask a question about, but you really want your colleagues to know about?
I don't have any.
Just that really, if your patient's doing a 10-second test and you do it that's 50 seconds. That's less than a minute out of your treatment time, and it's something that's really consistent that test is not changing, but maybe the assistive device is changing, maybe the gait pattern is changing. And so that controlled environment gives us a better perspective as to what's making the difference in your patient's progress. And that's really valuable information that we can use over the course of their rehabilitation process.
Those are great insights, Hoku. So I appreciate that. And we'll be glad to share this and anxious for everybody to see this and hear about your experiences in doing this pilot project. So thanks a lot, you guys. Have a good one today.
Thank you,
Thanks, Patty.
See you.